You that we worship and is your guidance that we seek. Ya Allah, keep us on the straight path. Ya Allah, show us the chase of blessings. Ya Allah, show us your mercy. Ya Allah, guide us. Greetings, salam, salutations, and our beloved Nabi Muhammadur Rasulullah sallallahu alaihi wasallam. It is time for Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faisal MJ Sulaiman. Assalamu alaikum wa rahmatullahi wa barakatuh. And we welcome our listeners on Radio Al Ansar, CII Radio, Voice of the Cape, Radio 786, Sirius FM, Radio Islam, and IFM Port Elizabeth, as well as all listening to us on audio streaming and other platforms. Our topic for discussion is vitiligo and other hypopigmentation skin conditions, and our very special guest this evening is Dr. Nofer Rabovi. Dr. Nofer Rabovi, assalamu alaikum wa rahmatullahi wa barakatuh, and jazakallah khair for joining me in the program.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Thank you very much, Faisal, for your kind invitation, and salams to the listeners.
Absolute pleasure, Dr. Rabovi. Just to introduce our guest, Dr. Nofer Rabovi is a dermatologist in private practice at the Westville Hospital and specializes in broad spectrum of dermatology. He's the president of the Vitiligo Society of South Africa, the president of the Dermatology Society of South Africa, author and co-author of several publications, including Vitiligo, author of book chapter on phototherapy, a treatment for vitiligo in prescribed textbook. For dermatologists published in the USA, presents lectures extensively at overseas congresses, taught at University of KwaZulu-Natal for 25 years, and is our guest tonight. Dr. Rabovi, just to kick off the discussion, what is vitiligo?
All right, vitiligo, first of all, is a skin disease. We see this as white patches on the skin. It can occur anywhere on the skin, and I think we see people with vitiligo all over the place. It can occur on the face, on the arms, and people are really worried when this condition occurs on the face. So the condition happens because pigment cells in the skin are damaged by one's own body, and that's how it happens. So vitiligo basically is a skin disease where the skin turns white in patches. Basically, that's what it is.
And is this happen, for all ages or specific ages?
It happens across the board. It can happen close to childbirth. It can happen close to the 90s even. It can start at any age. But the majority of people who have vitiligo have it starting below the age of 20. In the majority, that's when it occurs.
And is there any particular group, race group that gets?
No. Contrary to popular belief, it occurs in the same prevalence in all race groups across the world. Okay. So the worldwide incidence of this is 1%. In other words, 1 in 100 people develop vitiligo. Mm-hmm. The problem is on pigmented skins, it is much more visible. This is the issue, that on light-colored skins, it's not so visible. So much so that when we look at guidelines for treatment of this condition, in Scandinavian countries, for example, the first-line treatment is to do nothing.
Okay.
But you can't do nothing in places like South Africa and in India where it's so visible. So it occurs in 1%. But there's one place in the world where the incidence is actually much higher, and that is in Gujarat, in India.
Okay.
So we don't understand fully why. Some people believe it's because of rubber factories there and so on. But we call it vitiligo if the cause is unknown. And when there is an associated cause like chemicals and so on, then we call it leukoderma or post-inflammatory hypopigmentation or depigmentation.
One would have thought Gujarat got something to do with the diet and the spices, etc.
Yes, indeed. We'll have to look into it and see why.
Probably in the next show. What impact does vitiligo have on individuals who have this condition?
Well, first of all, it can cause extremely low self-esteem. People who have vitiligo suffer more with anxiety and depression than in the normal population. It results in a huge amount of stigmatization. Now, fortunately, the stigmatization is not so common in this country as it is in India. Okay. In India, people who have vitiligo find it very difficult to get marriage partners. Okay. And if the parents have vitiligo, then they don't get proposals for the kids. And when I did clinics in India, during our tours and trips there to join our associates, we find that a lot of vitiligo patients are females of marriageable age or the parents of the bride-to-be. And of course, it affects any age. All kinds of people come in for treatment, but predominantly those would be the people that one sees. People who have vitiligo undergo job discrimination. They find it difficult to get jobs. And I know of people who told me that they have customers that refuse to take money from them because they feel that they will catch the vitiligo.
But I don't think it's contagious.
Not at all. It's not contagious. And this is where awareness comes in. We've got to create this awareness that it is not contagious. We had a meeting in Kashmir, and one of the doctors that was presenting on the psychological impact of vitiligo presented the case of an individual who was going back to his home country and from Dubai, going back to his home country, and he had vitiligo of the arms, and he came to see the doctor to have his arm amputated.
Wow.
He said he's going back home, and he doesn't want anyone to see that he's got vitiligo. I mean, this is the extent
Serious.
of problems associated with it and the stigma attached to it. And I think we need to create the awareness throughout the population that this is not contagious. It doesn't do anything to the individual. I mean, if you look at it, you've got to treat vitiligo for other people because it doesn't affect the individual to the same degree.
Absolutely.
It doesn't hurt, it doesn't burn, it doesn't itch, it doesn't pain, it doesn't do anything except its visibility.
So it's just a cosmetic thing.
And people, well, it's because of the psychological impact, it's far deeper than just being a cosmetic thing. And look, there's a medical reason for it happening. And we need to also understand that vitiligo may be associated with other systemic conditions. For example, there's an increased amount of diabetes and thyroid disease and all the other autoimmune diseases that are associated with vitiligo. So vitiligo, we consider it to be an autoimmune disease. And autoimmune means the body is attacking itself. And there are other diseases where this happens, like the examples I quoted. Thyroid disease, diabetes, you can get joint issues like rheumatoid arthritis and so on. Any condition which is autoimmune is associated with vitiligo, and this is why it is a medical condition. But yes, its impact is hugely one that can be seen by others. I mean, people have cancer and they can hide it.
Yes, of course.
But you can't hide the vitiligo.
You can't.
And that's the problem associated with it.
Now, World Vitiligo Day is normally observed throughout the world. What is the significance of it?
Well, World Vitiligo Day, incidentally, was last week on the 25th of June.
Okay.
And this year, there were massive commemorations and celebrations all over the world. We had a talk on Radio Lotus on the 25th of June. And just the weekend before that, we had a Zoom meeting for people with vitiligo. And in 2020, we had the first Zoom meeting, and we had 18 countries participating in that meeting.
Okay.
World Vitiligo Day is the day that Michael Jackson demised. He passed away on that day.
Okay.
And you know that Michael Jackson's vitiligo was not accepted by the world. People made accusations that he was trying to emulate and be someone else, and that he wasn't satisfied with who he was, and it was a racial and ethnic issue. And so to commemorate that, World Vitiligo Day falls on the death anniversary of Michael Jackson.
Interesting.
And this is purely because one needs to raise awareness of this condition and let people understand the condition of vitiligo better so that they do not discriminate against people who have this condition. Treatment is available, but many people choose not to do anything with it. And we need to accept them for what they are, whether they have vitiligo or whether they choose to have treatment.
And what is the cause of vitiligo then?
Usually, vitiligo is considered to be an autoimmune condition. And autoimmune means that the body is attacking itself. But there are other theories as well. Like I mentioned just now, there are other autoimmune diseases associated with it. So autoimmune disease works like this. Let's say something gets into the body. It may be a medicine, it may be a virus, it may be a bacterium, and the body's immediate reaction is to fight that particular germ. Now, it makes those cells or the antibodies or whatever it is to fight those germs, but by mistake, it goes and attacks the pigment cells in the skin.
Okay.
And the pigment cells are what give us color.
Okay.
So it's a case of mistaken identity that the melanocytes, the pigment cells, get damaged. And so you see right through the colorless skin now into the deeper white colored layers. Now, we know that it is genetic as well. About 20% will give a family history. There's another theory of oxidative stress, and that means that toxins accumulate inside the pigment cells, and that cause damage. Then there's a neuronal hypothesis. In other words, we believe that the nerve endings release toxic substances that end up damaging the melanocytes. And then there's a concept called melanoragy, and melanoragy means that the melanocytes are so weakened that even a slight touch or slight bump against them injures them, and they explode, and they end up dying, the melanocytes.
Okay.
So those are the theories responsible for vitiligo, but mostly it is regarded as an autoimmune disease.
So it's not something that's hereditary, is it?
Yes, it can be.
It can be.
About 20% of people give a family history, but not everyone gives a family history. And that is interesting too, because you might not get a family history from somebody who's got vitiligo that they've covered up. They don't go around saying, I have vitiligo, or they don't wear a badge.
Of course.
They don't write it on their foreheads. So there are a lot of people that have it that others don't know about. You'll only know about it if it's on the face or the hands or some exposed part of the body. So we believe that the family history is actually a lot higher than it's made out to be, or that we can glean just from asking patients if they have a family history.
This is an interactive program. We are discussing vitiligo, and our special guest is Dr. Nofer Rabobi, a dermatologist in private practice, practicing at the Westfield Hospital, and who specializes in a broad spectrum of dermatology. The number for the WhatsApp number for your questions to Dr. Rabobi is 060-904-1056. I repeat, 060-904-1056. Please base your questions on the topic that we're discussing and any dermatological condition that Dr. Rabobi can help you with. Dr. Rabobi, we've got our first question that's come through. Does the glutathione drip cause vitiligo?
It's interesting that you asked that, because just today I saw a patient who developed vitiligo after having a glutathione drip.
Wow.
And this was actually something that we had taken note of, and immediately is going to make us do surveys of patients who have vitiligo and who had a glutathione drip. So the jury is out there, that that the dermatologists are prohibited from offering glutathione drips. And that's because of very severe problems associated with it overseas. For example, people have been admitted to hospital with what we call Stevens-Johnson syndrome and so on, and this is a very severe life-threatening skin condition. So you'll notice the Dermatology Society of South Africa has prohibited its doctors from offering glutathione drips to anyone because of the dangers associated with it, and the fact that the issues have not been proven with glutathione. So until we have more information regarding glutathione and what it does in the body, it is not going to be offered by dermatologists as such. Yes, it is possible. Glutathione, in fact, reduces pigment formation in the skin. So it stands to reason that it is possible for it to end up literally overdoing it in the body. And the fact that we've had this issue, we are certainly going to look deeper into it and run international surveys to see how many in the world have actually seen this phenomenon. And we'll, in fact, write it up and publish it, and that's what gets us the information that we need. We also belong to an international forum, and we'll express this idea to the international forum, and from there work out our surveys that we are going to ask.
So while dermatologists are prohibited from using this particular drip, are any other sort of practitioners also prohibited, or is this specifically for dermatology?
Well, it has to be. You'll find that most people that offer the glutathione drips are actually alternate practitioners. They don't fall under the Health Professionals Council. So, for example, if we commit any misdemeanors, we are hauled over the coals by the Health Professionals Council, and this keeps the practice of medicine up to a certain standard. Now, those that are offering glutathione drips don't fall under the Health Professionals Council. And if anything happens to any patient having had the drip, the Health Professionals Council will not be able to do anything to them. And sometimes they don't even fall under their own board. There's no board that they fall under, or they're not answerable to anyone. So if something like this happens, you can't even take it up anyway.
Another question has come through. Can one dye their hair if they have vitiligo on the scalp?
Generally, yes. If you have a hair dye allergy, then of course it's not advisable. And the reason for that is if you develop an eczema from the hair dye, in other words, this is an allergic reaction to the hair dye, then that can heal with lightening, right? It can heal with loss of color. In fact, if you have vitiligo, you can get vitiligo from as a post-inflammatory phenomenon, and that means that some inflammation can promote vitiligo. So in general, if there's no reaction to the hair dye, it is possible to use the hair dye, but one has to exercise caution with whatever chemical one puts on the skin.
Okay, there's another question that's come through. Salams. I use a glutathione night cream.
Glutathione?
Glutathione. Is it safe to use?
Well, it depends on what else is in there. We'll have to look at the formulation to tell you whether it's safe or not. But generally speaking, glutathione that's applied on the skin doesn't have the same restrictions as glutathione that's given by intravenous injection. So in general, it's something that is present in many formulations, and that is not prohibited from use, but we'd have to see how it is combined and where it comes from and what ingredients are in it and what percentages and so on before we can make any comment about a particular product.
Remember that doctors and guests on the Medical Files program will help you with any medical problems you pose by giving you advice on air. However, they do not have your full medical history and have not examined you. Please verify the advice given to you on air with your regular doctor who knows your medical history, your allergies, etc. Neither the doctors, nor the relevant radio stations, nor the Islamic Medical Association of South Africa will take any responsibility for any adverse reaction caused by the advice given on Medical Files. Also remember that this is an interactive program, and you can forward your questions via WhatsApp on 060-904-1056. Doctor, another question has come through. How harmful is sunlight for vitiligo? Can it cause cancer?
Now that is interesting, that actually skin cancers occur at a lower incidence in vitiligo patients than in patients who don't have vitiligo. And it also applies to melanomas and so on, because remember, the body is attacking pigment cells. So when these pigment cells form, they get attacked and damaged. Mm-hmm. Now, sunblock is very important to use because the vitiligo skin has got absolutely no pigment and it can burn more easily in the sun. But having said that, a lot of the treatments that we use for vitiligo are actually based on sunlight.
Okay.
The ultraviolet light that we use, for example, narrowband UVB and excimer light and so on, are all light-based devices. And previously, we used to use creams that applied on the skin, and then we expose the skin to sunlight. So sunlight is to a certain extent beneficial for vitiligo. But one's got to be careful that you have the sunlight early in the morning or late in the afternoon, and not say sort of between 10 and 3 where the sun is very high up in the sky. Mm-hmm. And that can cause sunburn easily. So yes, it has its benefits. And believe it or not, the modern phototherapy was actually born out of the papyrus scrolls that were seen when the Egyptians and the British went and excavated the tombs of Tutankhamun. Mm-hmm. And they found all these papyrus scrolls, and one of them was on how vitiligo was treated in ancient Egypt.
Oh, interesting.
And so when they discovered these papyrus scrolls, they saw that the patients were treated with something that was later discovered to be sorrelin. They were treated with a plant that grew in Cairo, in Egypt, mm-hmm. and then they were exposed to sunlight for a certain period of time.
Okay.
And so, of course, the sun didn't rise much in England, as you know. The sun mm-hmm. is hardly visible there.
Absolutely. Yeah.
So they decided to make a machine that emulated sunlight. And they refined the product that was found in this plant, and that became sorrelin. So we administer sorrelin and then expose to ultraviolet light in a cabinet. Now, of course, these days we regard the machine treatment and the treatment from these cabinets to be a lot more specific and a lot more beneficial, because we've identified the type of light from the sun that actually fixes up the vitiligo, mm-hmm. and we can administer the dose very carefully for the amount of dosage that is required for the patient. In other words, if we had just sunlight, the patient would end up getting excessive amounts mm-hmm. or too little.
Okay.
So we can measure it more accurately. Mm-hmm. But yes, sunlight has been used for vitiligo and still is in many places.
In fact, you just answered the next question that's come through. And the question was, what treatments do you offer for vitiligo? I know it's not curable, but can be treated. And I think you have dealt with that right now.
Well, there's many more treatments in that.
Let's go for it.
First of all, it depends on the extent, right? So the extent of vitiligo will determine what we do with it. Mm-hmm. If it's a small patch of vitiligo, we can treat it with creams. And the word for applying medicines is topical treatment. Topical means to apply, as opposed to oral or systemic. Mm-hmm. And under the topical treatments, the most widely used would be the topical corticosteroids. And then there's another group that's called the TCIs. We won't mention the full name because you need special jaw exercises to say this thing. Right? One of them is called tacrolimus and the other one is called pimecrolimus. And many of our listeners will know it by the names of Protopic and Elidel. And then we have antioxidants like Vitex gel. And then we have now what is really new and current and is undergoing a lot of investigations throughout the world is what we call the JAK inhibitors. Now, this is not what we use to raise a car to change its wheels. JAK stands for Janus kinase. It's an enzyme in the body that's responsible for creating vitiligo. And these JAK inhibitors, there are two of them. They're called tofacitinib and ruxolitinib. Now, these have been approved by the American FDA. In this country, we don't have it as a product that one can purchase from the pharmacy. And I'm sure it will come eventually. We can get it made, though, and we are using it already. So in other words, we get it manufactured with these, in fact, raw materials, and then these are applied on the skin to good advantage. And we've been using it now for more than a year with good results.
Alhamdulillah.
And this would be the most current treatments available for vitiligo. So to stress and reiterate, it would be tofacitinib and ruxolitinib. And both these are now available and we are using it extensively. Now, I mentioned to you briefly phototherapy. This would be inside a cabinet for large areas, and for small areas, we use it in the form of an excimer laser. Now, the excimer laser is a much more powerful device. And for example, where you need 3 treatments of narrowband UVB, ultraviolet B light, we use 1 treatment of excimer laser. So it's much faster. Now, there are a lot of other treatments, and perhaps we could take a few more questions and come back to the other treatments. Otherwise, the listeners will get bored and get information overload.
Lots of questions have come through.
Right.
So if we've got a minute for the ad break, I'll pose a question. Maybe you can handle it.
Okay.
Assalamu alaikum. My son is 10 years old. He has vitiligo. Is it caused by toxins in the liver?
Shall I answer that now?
Well,
Yeah.
If it's
Yeah.
going to take more than a minute, then
No, it's fine.
Okay.
It's not. It's got nothing to do with the liver. And I've heard the term erroneously referred to as white liver. So that's the corruption of the term vitiligo, as some people pronounce it vitiligo.
Okay.
And so it sounds like white liver. It's got nothing to do with the liver turning white.
Okay.
And it's got nothing to do with toxins in the liver. Yeah, we believe there may be toxins inside the pigment cell or toxins inside the nerves that supply the skin in that area. But it's got nothing to do with toxins in the liver.
Thank you for that, Dr. Rabavi. It's time for us to visit the marketplace. We'll continue on the other side of this. You are listening to Medical Files. Our topic for discussion is vitiligo. Our special guest this evening is Dr. Nofal Rabavi, a practicing dermatologist. And we'll take the break. We'll continue on the other side of this, inshallah.
At Amina's Wonder
Sure.
Spice, we know
The question I'm calling you very early, right?
enjoy the pleasure of cooking with our 100% pure ginger.
I can't see me scratching.
Yeah.
I scratch my nose. They think I'm doing something else.
My daughter is 4 years old and we have recently discovered she has vitiligo. My question is, because she is a young age, is it possible that the skin can become completely lighter, or is there a possibility it can be cured?
Okay.
So that's the next one.
Right.
Is it possible to have skin grafts?
Yeah. Okay, then we'll handle the.
I've got a whole new set of questions coming in.
Very good.
Yeah.
Very good. There's a lot of interest.
As I said, we're on 7 different stations, so all over South Africa.
Every pure diamond becomes more than just a girl's best friend.
I was doing a gardening program on Channel Islam. I got a call from a captain on a ship in the middle of the ocean. Somewhere.
What are you saying?
Hey, unbelievable. She spelled glutathione wrong.
Glutathione.
Yeah, she
And
spelled it wrong.
I knew what she was trying to say.
Yeah, I know. Late
We got
like us have a problem.
we got to improvise and we got to sort of, assume.
Yeah.
The Watch Doctor. For watch repairs,
This is not on. They can't hear.
No, you're off.
keyless keys, engraving, and sound for your occasion. Handled professionally at 263 Sparks Road, Mohammedia Center, Suite 104, Overport. Next to Sparks Road, Masjid.
Oh, man.
Zain on 082 542 3070. The Watch Doctor. The Watch Doctor. Keeping time every time.
Are you or a loved one battling the disease of addiction? Is your family, life, relationships, work suffering due to alcoholism and substance abuse? Zenside Treatment Recovery and Wellness Center are addiction specialists.
You know, when you get these questions, people are listening to you.
Yeah, eh?
But even if you don't, many times you had a nice program last night. Can I get the podcast? I heard part of it.
Oh, really?
Okay.
Going back after.
Addiction, call Zenside Treatment Recovery and Wellness Center, the addiction recovery specialist on 031 563 0751.
You're listening to Medical Files, and Medical Files is brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faisal M.J. Suleiman. Our topic for discussion is vitiligo and other hypopigmentation skin conditions, and our very special guest this evening is Dr. Nofal Rabavi, a practicing dermatologist who is in private practice at the Westville Hospital. Dr. Rabavi, the questions seem to be pouring in, alhamdulillah. The next question has come through is, Assalam. My daughter is 4 years old and we recently discovered she has vitiligo. My question is, because she is a young age, is it possible that her skin can become completely lighter, or is there a possibility that it can be cured?
Yes, 4-year-olds can be treated, of course. And you know that vitiligo is divided or classified into very many different types.
Mhm.
One of them is called focal vitiligo, where it occurs in a small area,
Mhm.
right? Maybe the size of a hand or maybe even smaller than that. And you can get generalized vitiligo, which is more extensive. You can get universal vitiligo, which affects the whole body. You get segmental vitiligo, which affects only one side of the body.
Mhm.
So you can see that there are many different types of vitiligo. And it doesn't mean that one will always progress to another. We see many patients who have one small area of vitiligo and that's all they have throughout their lives. And yet we see some patients, they make up the minority though,
Mhm.
in which case it spreads and it involves large areas of the body or even the whole body. It's very rare for that to happen. Now remember that when it's in a small area, you can treat it with a cream, you can treat it with excimer laser, which we get very good results with. We treat it with ultraviolet light that we mentioned earlier, that we get good results with. And we can treat it with these topical medicines that we mentioned earlier, the steroids, the calcineurin inhibitors, the Vitex, the JAK inhibitors, all those can be used. So at the age of 4, we've used excimer laser all the time, right? We've used ultraviolet light all the time. Now, if it becomes very extensive, remember there's one more treatment, and that's called depigmentation treatment, where it is not worth trying to put color back. If it's more than 90% of the body involved, we try to remove the color from the remaining 10% and make the body, the entire body, completely white.
Okay.
And we have a lot of patients who come and have this type of treatment, and they are much happier having one color than to try to repigment the skin, which is almost impossible if it is that extensive.
So it doesn't affect them physically at all. I mean, I know
No.
you're not the appearance. What I mean is by changing the color, etc. There's no side effects or anything of that
The
sort.
only side effect is that they're more susceptible to sunburn.
Okay.
So they've got to be a little bit careful because the skin is now completely colorless.
Another question: is it possible to have skin grafts done on the vitiligo area?
Yeah, in fact, we do several different kinds of grafting procedures for vitiligo. One of them is called suction blister grafting. And suction blister grafting means that we would make a small blister on a normal part of the skin.
Okay.
Then we take the roof of that blister and transplant it onto an area of vitiligo after peeling the skin from the vitiligo area. We remove only the epidermis. So the epidermis can be removed and a new epidermis forms normally. So if you take the roof of a blister, it is pure epidermis. We transplant it onto the vitiligo area. It's transplanted with all the pigment cells, and the pigment cells grow there. And this is particularly useful for areas like the lips and so on. Then there's another kind of grafting procedure that we do called punch grafting.
Okay.
So there we take tiny little pieces of skin. They're about 1 millimeter in diameter. And from the vitiligo area, we'd make little holes. In other words, we take the vitiligo skin out at intervals of about 0.5 centimeter, and we discard that skin. And then from an area where there is color, we take a whole lot of 1 millimeter size pieces of skin close together, and we take these and transplant them onto the holes that are made on the vitiligo skin. And that works particularly well. In fact, in our congress now, the dermatology congress that we are having in PE in a month's time, we've got an overseas guest from Korea that's coming to demonstrate a new technique of punch grafting using a hair transplant apparatus. And that means we can get very, very tiny grafts. They're 0.5 millimeters to 0.8 millimeters. And the reason and the advantage of that is that we see very little scarring from the procedure.
Okay.
So these procedures are being refined. Then another grafting procedure that we do regularly is called non-cultured melanocyte grafting. Now there we would take an area, for example, from the thigh. We would remove a little piece of epidermis, and we use a blade to remove that. It's very, very superficial. That area heals almost unnoticeably.
Okay.
We then put some trypsin on it. This is the enzyme that's used to digest meat in the stomach. So we take this particular enzyme, it's of animal origin. We from beef, from cows, right? So this is used to digest the piece of skin and separate the cells out.
Okay.
So in about 40 minutes, the cells are prepared. We then take those cells and transplant them onto the vitiligo area after the vitiligo epidermis has been peeled off. So this is called non-cultured because we are not growing the pigment cells in a laboratory. We are taking it straight from one end and putting it on another end. And this is called non-cultured. You can also culture the melanocytes.
Okay.
In other words, you can take the pigment cells from one area of skin, send it to the laboratory, grow the cells there, and then transplant it onto the skin. And I just want to mention one more surgical treatment, and that is called needling. So needling means that we take a needle and pierce it from the normal skin into the vitiligo skin, and that creates a channel through which the pigment cells migrate and go into the area where there's no color.
Okay.
And that's called. So that, in summary, is what surgical treatments are available.
Very interesting.
Very much so.
Absolutely.
Yeah.
I've been treated by Dr. Rabawi. Excellent results. Took time, but he left no stone unturned. He has good bedside manners and makes one feel totally uncomfortable. Thank you for that. That's one of our listeners.
Thank you very much for that. I really appreciate those kind remarks. Thank you.
Dr. Rabawi, tell me, what support is available for vitiligo sufferers?
Well, first of all, we have a good website, and that's the website is vitiligosociety.co.za. And there you can even find a dermatologist near you. We have a list of all the dermatologists that are interested in treating vitiligo, and you can see exactly what facilities they have. In other words, who offers ultraviolet light, who offers excimer laser, who offers the surgical treatments. And close to you, you can see it's listed by province.
Okay.
So if you live in Johannesburg, you can go and find a dermatologist in Johannesburg who has these interests. Because I've heard a lot of times that people went to a doctor and the doctor was not interested in the vitiligo and said nothing was available and they had to live with it and apply a cream, and that was the end of the story. And you've heard now, from what we've been chatting about, just how much is available for vitiligo. And so we don't have to turn any patient away. Now also, there are support groups, international support groups. There are support groups locally. And we would encourage people who have vitiligo to join one of these support groups. We've just started and reinitiated a Facebook page.
Okay.
That's called the Vitiligo South Africa support group. So please go into that Facebook page and have a look. We had an active Instagram page, which actually needs to be put back in the fold. So we'll work on that. But right now we have the website and we have the Facebook page. And please go and have a look there. And remember that one can also meet physically with patients who have vitiligo. And if anyone is interested in that kind of support group, we have an annual meeting. And we used to have this at Westville Hospital, and people gathered there. The first meeting we had was at Albert Luthuli Hospital. We had 500 people attending. There wasn't even standing space in the room. So in other words, these meetings are hugely popular, and we would encourage patients to join support groups and meet physically to discuss their vitiligo and so on. There's also a lot of scope for patients to get involved. In other words, they can write articles that help other people and they can share their experiences. They can write stories about the vitiligo. They can write poems. I mean, I'm sure we have a lot of talent. From what I've been reading over here, people are very articulate when they write in. And by all means, we need people who are innovative, who can sing and maybe write a song about vitiligo, and who can draw and they can make illustrations and showcase vitiligo in photos. We've had this in the past. We can have competitions for drawing and that kind of thing. So in other words, the contributions that one can have for support are limitless. We'd like to hear from the listeners as well, what ideas they have about creating awareness.
You'll be bombarded with ideas. Because I think it's important to create this awareness. And I think you just mentioned, the different ways one can create the awareness. And of course, in that way, create the support groups as well.
I can tell you one more thing that we did. We made a poster highlighting what vitiligo is, the fact that it's not contagious, the fact that it can be treated, and to tell people to be kind and gentle to people who have vitiligo. Now, we made this poster. It's on the Vitiligo Society website, vitiligo.co.za, and it's available in English. It's available in Afrikaans, in Zulu, in Sotho, in French, and in Arabic.
Okay, excellent, excellent.
And if there's anyone that's listening that speaks any other language and is willing to translate this poster for us, then here's another activity for you to support the Vitiligo Society, which will be directly supporting vitiligo patients.
060-904-1056. I repeat, 060-904-1056. Any questions for Dr. Naufal Rabawi on the vitiligo, please, you've got like 15 minutes to pose those questions. Now, Dr. Rabawi, you did mention earlier when we just started that many learners are discriminated against, especially in school. Now, what can be done for learners who are discriminated against?
Well, I think an excellent idea is for learners who have vitiligo to talk about the vitiligo in their schools. And I think they need to grab the bull by the horns and go and explain. For example, one school was given these posters, the one that I just spoke about, and they distributed these posters to the school pupils so they could see exactly. And this is an ideal example of something that can be done in schools. Sometimes parents need to get involved, and they need to speak to the teachers, and they need to speak to the principals about bullying in school, for example. Then we can have plays in school. They can simulate a sort of a child being discriminated against, and the teacher getting involved, and how they went to resolve the situation. And I mean, just picture in your mind how we can create a play. And we would be very encouraged if there are teachers listening in, if there are pupils listening in, about them enacting a play in school to create awareness of vitiligo. And these are some ideas that we can use. You can have a fun run. You can get all pupils with vitiligo from various schools and have a fun run. That can be done as well. There are a lot of ideas.
I think it's brilliant just to show that these are normal people.
These are normal people that can do normal things,
Exactly.
and they don't need to be discriminated against.
Absolutely.
Awareness is the key factor here.
Are there any problems associated with ultraviolet light treatment?
Ultraviolet light can cause a sunburn reaction if the dose is too high. So for that reason, we start with very low doses, and we gradually increase the dose so that the body hardens to it and is able to handle the treatment. So whether it is narrowband ultraviolet B light, or it is excimer light, or another kind of light that's called ultraviolet A light, we start low and go up gradually. Now, ultraviolet A light is not used as often as it used to be in the past because it's associated with certain skin damage, right?
Okay.
Whereas ultraviolet light has not been associated with skin damage. It's used extensively throughout the world. So the two things that we need to watch out for are sunburn reactions and any lumps or bumps and so on the skin.
We're going to take our ad break, and on the other side of this, we're going to continue the program. Dr. Rabi, the next question that's come through, you can just think of doing the ad break, is, does swimming have an impact on vitiligo? We'll continue after the break.
Simplex Radio 65th birthday sale is here.
Samsung 65-inch UHD Smart 4K TV, now 7,999, saving you 3,000 Rand.
Samsung 43-inch UHD Smart 4K TV, 4,999, save 1,500 Rand.
Hisense 55-inch UHD 4K Smart TV, 5,999, saving 1,500 Rand.
Hisense 85-inch 4K Smart TV, 17,999, save 4,000 Rand. Get it today, 202 Kenilworth Road, Overport. Open Sunday, July 7th until 2:30 p.m. Simplex Radio, the name you can trust.
At this time of trial and worry, the blessings of charity are the ideal means to avoid calamity and despair. The Al Imdad Foundation gives you the opportunity to sponsor a share in a borehole in South Africa for just 1,000 Rand and provide what the Holy Prophet, peace be upon him, called the best form of charity. Donate online at alimdad.com or call 0861 786 243 for more information.
Hey there, Durban. Get ready for the best winter shopping event. It's time to shop till you drop at the Durban Shopping Fest from the 5th to 7th July. We've got it all from trendy fashion to jaw-dropping deals. This is the perfect place to be. Picture yourself strolling through aisles of your favorite stores, discovering hidden gems and snagging those must-have items while having a phenomenal variety of the best cuisine waiting for you in our food court. Don't miss out on the Durban Shopping Fest. Join us at Saxony Westwood Mall and let the shopping spree begin. Store bookings now open.
You're listening to Medical Files, brought to you by the Islamic Medical Association of South Africa, hosted by myself, Faisal MJ Suleiman. Our topic for discussion is vitiligo and other hypopigmentation skin conditions. Our special guest is Dr. Naufal Rababi, a dermatologist practicing at the Westville Hospital and who specializes in broad spectrum of dermatology. Now, the number for your questions, or WhatsApp number rather for your questions, 060-904-1056. 060-904-1056. We've got like 13 minutes left for you to pose your questions so that Dr. Rabi can deal with them. Dr. Rabi, just prior to the ad break, the question came through was, does swimming have an impact on vitiligo?
Yeah, no, we would encourage swimming. There's no reason why you should stop swimming. And patients, people with vitiligo should be encouraged to become healthy and strong and so on. There's no problem. The one thing you're going to be careful about is where you're swimming, because if strong sunlight lands on the skin, you can get sunburnt easily, as we mentioned earlier. It's a good idea to use a sunblock if you're swimming out in the open. If you're swimming indoors, it's not an issue. So there's actually no problem at all associated with swimming.
And what happens if the vitiligo is noted to be spreading?
We would call that situation unstable vitiligo, right? It's very important for us to stabilize a vitiligo. And stabilization means no new areas of vitiligo for 1 year. And if we are doing any surgical treatments, for example, that would be the definition by which we would consider doing any surgical treatments. Now, if we notice that new areas of vitiligo are developing, that has to be halted immediately.
Mm-hmm.
And we have several medications that can do that. One of them is minocycline, which is an antibiotic. And minocycline, some listeners will remember in the old days, we used to use it for acne as well. And it's an antibiotic, basically.
Mm-hmm. Mm-hmm.
And this particular antibiotic modifies the immunity as well. So it stops the immune system from damaging the pigment cells in the skin. And so we use minomycin, or minocycline is the other name for it. And this is used to halt the progress of vitiligo.
Mm-hmm.
And the second medicine that we use for it is an oral steroid, namely betamethasone. This medicine is given on Saturday and Sunday every week for several weeks,
Mm-hmm.
maybe up to 3 months. And the reason we use it just on weekends is because if you give this medicine every day, it can cause patients to gain weight, and it can worsen diabetes, and it can worsen high blood pressure.
Okay.
And for that reason, it is used only once a week on a Saturday and a Sunday, right? Well, on 2 days a week. So we'd use this. The steroid actually stops the immune cells from attacking the pigment cells. That's what it does, right? And when we give it just on 2 days a week, the side effects are not as great as giving it every day. And we use it even in kids, sometimes at a lower dosage,
Mm-hmm.
but it's used in kids and it's used in adults as well. The thing that we've got to worry about in children is if excessive doses are used, it can affect the growth, and it can cause thinning of the skin and sometimes hair growth. So we've got to worry about those side effects. We look for them, we are mindful of them, and we give it at doses that won't actually produce those effects. So the moral of the story here is, if it is unstable, the first thing that we owe to the patient is to stabilize the condition so that no new areas develop. And that simultaneously, we try to repigment or recolor the skin.
Mm-hmm. Thank you for that, Doc. Can I get an eczema on the vitiligo area?
Yes, you can.
Okay.
You can certainly get eczema on a vitiligo area. You can get eczema anywhere. And it doesn't make it more common for you to develop an eczema. But if you have eczema, it is possible to get it. We don't often see them together.
Mm-hmm.
We either see eczema or we see vitiligo.
Okay.
But it is possible to get it together, yes.
Okay. I think you've dealt with this. Any medication to take for vitiligo? You've dealt with this, I think, already.
Medication, yes. We've dealt with that extensively.
Mm-hmm.
As far as the systemic medicines are concerned, we mentioned already the corticosteroids and minocycline. The JAK inhibitors are experimental at this stage. For example, there's a new JAK inhibitor that is called upadacitinib, and that's what we are using very extensively for eczema at the moment.
Mm-hmm.
And that is undergoing clinical trials throughout the world for vitiligo. And I suppose it won't be long before we have an oral JAK inhibitor that we can use. I've mentioned already all the surgical treatments. We've mentioned all the topical treatments. We mentioned also the way we depigment the skin. And perhaps at that point, I should mention that in addition to a medicine that we use to apply on the skin, that's called monobenzyl ether of hydroquinone. So don't worry about the long name. But there is a medicine that we have that can take the color out of the skin. We can also use a laser machine to take the color out. And we can use liquid nitrogen on the skin to take the color out. But that we use only when it's extensive. And remember that there's a very important role for cosmetic camouflage. And cosmetic camouflage would be makeup and so on to cover the vitiligo areas. Don't forget psychological support for those who need it. And remember, I was doing once a talk for an American TV channel, but by remote, I was here. I didn't have the luxury of going there to do it. But it was an American
One
TV
of the few times you didn't have the luxury.
Yes, that's true. So, there were others in the panel.
Mm-hmm.
And so one of the members of the panel came up and said, well, what makes you think we want to treat the vitiligo?
Okay.
So I said, well, we are on the show here because people want to know what they can do with it.
Yes, of course.
But of course, if people are comfortable with the vitiligo and they feel that they don't want to treat it, that's also an option.
Mm-hmm.
I mean, there are some very famous models around that you might be familiar with that actually promote vitiligo and don't want to have it treated at all. And one example is Winnie Harlow, that people might know, that she's on covers of magazines and so on, and she gets those posts because of her vitiligo. And this creates a positive impression of people who have vitiligo.
Regarding a fashion statement.
Yeah, a fashion statement.
A fashion statement. Okay. Assalamu alaikum. Is this hereditary? And is it passed essentially to females? And what percentage of males versus females have this condition? Jazakallah.
Now, it occurs both in males and females equally, and it can be inherited, yes. And the family history that one gets is about 20%. However, if one parent has it, then the chances of a child getting it would increase, because the normal prevalence is 1%. In other words, 1 out of 100 in the population would have it. So from 1%, if one parent has it, the likelihood of a child getting it increases to 5%. So that, in other words, it would be 1 in 20 instead of 1 in 100. So that would be the genetics of it. But there's a lot of good work being done on the genetics of vitiligo, and new information is coming out all the time. So watch that space and we'll have more information on it.
Inshallah. Okay, now here's a plea from a listener. Can you please try and get a cure for vitiligo?
I'm trying.
I know it's a long shot asking this question, but since you have been so long in the field and so experienced, excellent work, doctor. Keep it up, very informative. Jazakallah khair for that.
Jazakallah, thank you very much. I can tell you that we have a worldwide vitiligo forum that meets regularly. This year's meeting is in Cairo, and people who are interested to attend, come and make a trip to Cairo and come and listen to all the new developments in vitiligo. So a lot of new information is being discussed regarding vitiligo. Vitiligo has become the topic of many journals and so on, and I think this is spurred on by the discovery now of the JAK inhibitors. And you know that a disease becomes important when new discoveries and new medicines are found for it. Like psoriasis became important when they discovered the biologics.
Okay.
Before that, it was a neglected disease. Nobody had any interest. And vitiligo right now is undergoing that kind of revolution.
Excellent. Okay, there's a question that affects dermatologists, I think, but with nothing to do with vitiligo.
Right.
Okay. Salams to all from Anonymous. What can I use for fingernail fungus? I used an amber nail paint in a little bottle years ago. It was imported, but it's not available now. I was prescribed terbinafine tablets, but I'm worried about the side effects at my old age. What can I buy that's really effective, even if I have to get a script?
Well, look, the first thing that we have to decide is whether it is in fact a fungal infection. And we do that by taking a nail clipping and looking at it under the microscope in our rooms. So your dermatologist will take a clipping of the nail, dissolve it in a little bit of potassium hydroxide and look at it under the microscope. And then can tell you whether there's fungus there or not. So if that is not possible, or let's say the dermatologist doesn't do that particular procedure, he can take a clipping of the nail and send it to the laboratory. And in the laboratory, they would first examine it under the microscope, and secondly, they would grow the fungus in the laboratory and find out whether it is there or not. The reason for that is psoriasis can look exactly like a fungal infection. An injury on the nail can look exactly like a fungal infection. So the first thing we must do is to get the diagnosis right. Now, once we've made the diagnosis of a fungal infection, it will also depend on what kind of fungus you got in there. There are 3 kinds of fungi that cause disease. We call them dermatophytes, yeasts, and molds. Now, one of them, dermatophytes, do very well with terbinafine, and that is a drug of choice for it. However, when it comes to molds and when it comes to candida, for example, yeasts, then the better medication for that would be itraconazole or fluconazole. And those are called broad-spectrum antifungals. They are used differently. In the old days, we used to use griseofulvin, and that used to be used for 9 months or a year, or maybe longer, depending on how long it took for the nail to grow.
Absolutely.
But these days, these medicines for the fingernails, terbinafine is given for 2 months, and the itraconazole is given for 2 months as well, but they're given slightly differently, right? So we won't go into the details of the dosage, but just remember that those are the medicines.
Okay, a couple of complimentary things, messages come through. Jazakallah khair for a wonderful program. Well done to Dr. Rabawi, he's excellent. Assalamu alaikum, Jazakallah khair to all the practitioners for an informative program. Just open the mails are just pouring, the WhatsApps are pouring in. We've got like 2 minutes left.
It's okay.
Okay. Assalamu alaikum wa rahmatullahi wa barakatuh. I have cuts on my fingertips which are really painful. I haven't been using any detergents. I'm using thick nourishing creams on my hands every night. Is there possibility of a lack of something in the body? Any explanation will help. Jazakallah.
Well, cuts of the fingertips, we've got to worry about an eczema of the fingertips. And the way we work out the cause of an eczema is by means of a patch test. We stick 30 chemicals on the back, 2 days later, we peel those chemicals off and see which one has caused an allergic reaction, and then advise you to stop using that particular chemical. But just some general advice: be careful about handling detergents and washing powders and chemicals and so on, because they can cause a problem. My advice to you is to see your dermatologist and work out first the cause of the problem, and then he or she will arrange the treatment for you.
Dr. Rabi, unfortunately, that's all we have time for. I think there's lots of questions coming we can't deal with, and we apologize to listeners. But I want to thank you for joining me on the program. It's been absolutely wonderful and excellent talking to you. I've learned a lot about the condition.
Thank you very much.
But before you leave us, you don't just get away with that. You must have a message for our listeners.
Well, since we were talking about vitiligo and we were talking about hypopigmented skin conditions, if you think you have vitiligo and if you want to make sure whether it is or isn't that condition and to find out what is available, the message is that treatment is available for vitiligo. Please see your dermatologist or your GP and get the treatment that you need. Please do not neglect it. One final message is that if vitiligo is treated within 2 years, the chances of success are much higher.
You mean if you leave it for 2 years?
If you leave it for longer than 2 years, it becomes more difficult to treat.
Okay, the chances of success are much
higher. So in other words, the earlier you go and see your dermatologist, the better the outcome.
Jazakallah khair, Dr. Rabi, and thank you for joining me on the program. Assalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallah, and thank you to the listeners. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu wa rahmatullahi wa barakatuh. I want to thank all the engineers in the various radio stations for the excellent job that's been done this evening. And I want to thank the listeners for tuning into Medical Files. Medical Files will be back with you next Tuesday evening at 8 o'clock, inshallah. Until then, for myself, Faisal MJ Sulaiman, it's Assalamu alaikum wa rahmatullahi wa barakatuh.
Radio Al Ansar, Durban 90.4 FM, Peter Maritzburg 105.6